So welcome to the pharmacology class, and we returned from the winter holidays, and the today's topic is antihypertensives. And arterial hypertension is the most common disease in the world. So about 1/3 of all diseases is due to or connected with the arterial hypertension. And that is why there are so many drugs for the treatment, and there are so many patients uh, that will attend your pharmacy to get with a prescription for the antihypertensive medicine. So the classification of the anti classification of the antihypertensive medicines includes the following drugs. So there are many groups of the drugs, but the main groups include angiotensin converting enzyme inhibitors, and enalapril and captopril, as well as fosinapril and lisinopril are most commonly used. Also ramipril. So rami, there is a drug that is called after you.
Okay.
So one moment. I have troubles with the recording. So one moment, I have to check. Oh. So I have a message that recording is not good. So hope it will be resolved, but uh, so big there is a probability that I cannot record because of the some uh, some technical problem. So anyway, let's continue. So the angiotensin converting enzymes, actually ramipril after rami. So and then the second group is the beta blockers. So the beta blockers include metoprolol, most commonly used drug, and also the other orals, but uh, they all look they are almost the same, but the difference is only in the selectivity, and some of them also have additional properties, like for example labetalol also have some alpha 1 blocking activity, and propranolol is actually non-selective, and other mostly are selective, but not all of them, like nebivolol and nadolol are also non-selective. So selective are actually cardio-selective, like metoprolol, atenolol, carvedilol, and other selective beta-1 blockers, or cardio-selective blockers. The third group is diuretics, and diuretics include the thiazide diuretic like hydrofluorothiazide, chlorthalidone. Chlorthalidone is the most commonly used at the moment, and also the loop diuretics include furosemide and etacridinic acid, And the potassium sparing diuretics include the triamterene and spironolactone. So these two are potassium sparing diuretics. They are uh, most low potency antihypertensive. On the lowest potency, both have a potassium sparing activity, and then also there are osmotic diuretics, and osmotic diuretics are actually most uh, potent one. Uh, then the fourth main group is calcium channel blockers. And calcium channel blockers are less commonly used. All of the first four groups, and that mostly include nifedipine, uh, verapamil, and diltiazem. So these are the four most commonly used groups, and also angiotensin 2 receptor blockers are actually in the same group with the angiotensin converting enzyme inhibitors and renin inhibitors. So these three are one group. And angiotensin 2 receptor blockers, most commonly drugs are losartan and valsartan, and also and also candesartan. And the rest are the alpha blockers. These are selective alpha 1 blockers, toxazazine, prazosin, and terazosin. And these are only used in emergency because they have reflective tachycardia and then increase in blood pressure. And other drugs include also most these are used for hypertensive emergency only, except for methyl dopa. Methyl dopa is used in pregnant women. So, and clonidine is actually the central alpha or adrenomimetic that is used, so that it has a central action. So uh, the there are four categories of the hypertension, and the stage 1 and stage 2 pre-hypertension, and actually the emergency. So and the any increase of the systolic or diastolic pressure will be hypertension. So pre-hypertension usually does not require treatment. So that is why most patients that will require medication are stage 1, and stage 1 is actually 140 to 159 for the systolic and 90 to 99 for diastolic. And everything that is higher than that is stage 2, so like 160 systolic and 100 diastolic, and everything that is lower than 140 or for systolic and 90 for diastolic, then it is a pre-hypertension. Pre-hypertension usually only requires the lifestyle modification and the diet, low sodium diet, and does not require the medication treatment. So there are several mechanisms that influence the blood pressure, and most important are cardiac output and the peripheral resistance. So the cardiac output depends on the heart rate, the force of the contraction, and the pressure of the heart. So the pressure of the heart will depend on the volume of the blood that is filling the heart, also on the uh, uh, tone of the vessels of the vein. So specifically the portal vein. So and peripheral resistance depends on arterial torque. So the actually cardiac output is before heart, and peripheral resistance is after the heart. And there are several uh, ways that the body will regulate the uh, the blood pressure, and so these mechanisms include the baroreceptors uh, and the sympathetic nervous system, and the baroreflex is uh, is working by checking the pressure on aorta, and the it will change the activity of the sympathetic nervous system. And this is very fast acting system. So, and it will regulate the blood pressure very fast. Like when you feel some fear, the adrenaline is released, and then your heart rate will increase very fast. So the baroreceptors are in the aortic arch and in carotid sinuses. They send signal to the cardiovascular center in the brain and in the spinal cord, and this leads to the reflex, and the sympathetic system is activated and parasympathetic is deactivated. So that results in vasoconstriction and tachycardia. So the second system is much slower. It is the hormonal system, and but this system can control the blood pressure for a long time, and is done by changing the volume of the blood. The baroreceptors are located in the kidney, and they release the enzyme renin and uh, uh, then renin converts to angiotensinogen and to angiotensin 1. Then angiotensin 1 is automatically goes to the angiotensin 2 in the blood, uh, uh, and then angiotensin 2 is the most potent vasoconstrictor. It will increase the blood pressure very much. So and also the angiotensin 2 stimulates the secretion of aldosterone, then that increases the sodium reabsorption, and that furthermore increase the blood volume, which also increases the blood pressure. So actually blood volume increases pressure, and the vascular tone also increases the pressure. Uh, so the goal of the antihypertensive treatment is to reduce the morbidity and mortality from the cardiovascular diseases. And it's very important to decrease the blood pressure, and and for the most patients, the goal for the treatment is the systolic pressure less than 140 millimeters and the diastolic less than 90 millimeters. And most of the time, the mild hypertension can be controlled by one drug, and the current strategies recommend to start with the thiazide diuretic and angiotensin converting enzyme inhibitor, angiotensin receptor blocker, or the calcium channel blocker. And the second drug can be added to the first if the treatment is not complete. And usually if the patient has stage 2 arterial hypertension, then 2 or more drugs are used to start the treatment, because neither of the drugs will be effective in the monotherapy. So most of the time, and the treatment failure is because of the lack of the patient compliance, because the hypertensive patients are usually asymptomatic, and the treatment is generally directed at preventing the disease of the kidney or vascular disease or the heart disease, because the most patients will not feel any discomfort during the hypertension. And also the uh, adverse effects of the drugs can influence the patients more than the treatment goal and success. And for example, beta blockers reduce the sexual function in men, and then that may lead to the discontinuation of the treatment. So that is why it's very important to ask patients about their uh, lifestyle and about the uh, the readiness to suffer the adverse effects and select the treatment based on these responses. Like for example, beta blockers may be not the best choice for the young adults, for the young patients, and as well as the angiotensin converting enzymes may be not very so for the young adults, beta blockers are not good because of sexual dysfunction, and that may lead uh, to the problems in the family, so with the wife and husband. So because uh, the spouses can require some uh, the uh, this some sexual intercourse regularly, and also the angiotensin converting enzyme inhibitors may be not very uh, good for the elderly patients, because they can lead to the syncopes and to the dry cough, so that is why are not tolerated well. So that is why for the elderly the diuretics are recommended for the first line treatment, and usually hydrochlorothiazide and chlorthalidone uh, are used for the uh, initiating the treatment, and they decrease the water elimination, and that leads to the lower the blood volume and also blood pressure, and then the extracellular volume is also decreased, and then that decreases the heart output and renal blood flow. Then eventually the blood volume returns to normal, but the hypotensive effect remains because of the decrease in peripheral resistance. And the thiazide diuretics can be combined with the other antihypertensive drugs, including beta blockers, angiotensin converting enzyme inhibitors, and angiotensin receptor blockers, uh, and also potassium sparing diuretics, because thiazide diuretics will decrease the potassium that may lead to the uh, arrhythmia development. Uh, the diuretics are not effective in patients with kidney uh, diseases. So in especially thiazide diuretics are less effective. That is why loop diuretics may be required in those patients, and also adverse effects include hypokalemia, hyperuricemia, and hyperglycemia. So that is why contraindicated in diabetic patients. So the loop diuretics include furosemide, torsemide, and ethacridinic acid, and they block the sodium chlorine reabsorption, and they are effective in all patients, even with the kidney disease, and they can also lead to hypokalemia, uh, and they are usually combined with other drugs, and most commonly used for the treatment of heart failure and edema. So, and usually edema is uh, together with the heart failure. Potassium-sparing diuretics, amilorate and triamterene, and spironolactone and eplerenone, that are the latter two are the antagonists of the aldosterone receptor. They reduce the potassium loss uh, caused by the previous two groups of diuretics, and that is why they are commonly combined with the other diuretic to reduce the potassium loss. So the most effective group and the most uh, safe group is the beta blockers. So beta blockers are usually used in patients with heart disease or heart failure, and they reduce blood pressure by decreasing the cardiac output. So the prototype is propranolol, which is non-selective and will block both beta 1 and beta 2 receptors, and nowadays the selective beta 1 blockers like metoprolol and atenolol are prescribed mm, more. So other beta blockers can have additional blocking or uh, activities. For example, nebivolol additionally is selective beta 1 and increases the production of nitric oxide. That is also beneficial for antihypertensive effect. So the asthmatic patients can be suffer from the beta 2 blocking effect. That is why propranolol and nadolol are contraindicated, and selective beta 1 should be administered carefully. and in low doses, because high doses selectivity is relative, and beta 1 blockers will also block the beta 2, and also beta blockers should be used carefully in patients with the heart failure, because they decrease the cardiac output that is already decreased in patients with the heart failure. And the same is for the vascular diseases of so uh, also the beta blockers have antiarrhythmic effect. That is why they are beneficial for patients with arrhythmia, and also used in patients after the myocardial infarction, MI, and angina pectoris, and chronic heart failure. The main contraindications is asthma, and also the vascular diseases. So the angiotensin converting enzyme inhibitors are recommended as first-line treatment, especially for patients with coronary disease, or diabetes, stroke, heart failure, myocardial infarction, and chronic kidney disease. So the angiotensin converting enzymes inhibit lower blood pressure by reducing the peripheral uh, resistance. So angiotensin 2 has directly increases the peripheral resistance, and that is why decrease in the synthesis of the angiotensin 2 will decrease the peripheral resistance. And the cardiac blood output is not increased or decreased directly. So the angiotensin converting enzyme blocks uh, uh, the angiotensin converting enzyme that uh, leads to the activation of angiotensin 1 to angiotensin 2. So because angiotensin 1 is inactive and requires activation by the enzyme. So the most of the inhibitors is angiotensin converting enzyme inhibitors are taken orally as a drug or prodrug, uh, and uh, adverse effects include dry cough, rash, fever, hypotension, and hyperkalemia. So the most common effect is dry cough, and is thought to be due to the increased levels of bradykinin, and usually it uh, resolves several days after the discontinuation, and the cough usually occurs more frequently in women than in men. The potassium levels should be monitored, and potassium supplements should be uh, used uh, to prevent the uh, 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 the hyperkalemia. So the they're absolutely contraindicated for pregnant women, and also the women of childbearing age should be on contraceptives because the angiotensin converting enzymes can lead to the fetal malformations, and that is why uh, absolutely contraindicated. The angiotensin receptor blockers such as losartan and valsartan can be used instead of the angiotensin converting enzyme inhibitors. So they start block the angiotensin receptor and have the same effect, um, and they produce the dilation of vessels and block aldosterone secretion that leads to the decrease in the blood pressure and also decrease in the water retention. So the good thing is that angiotensin receptor blockers do not increase the bradykinin levels. That is why no cough, and usually they are used for the treatment of the hypertension in diabetic patients or patients with heart failure or chronic kidney disease. Uh, so the same adverse effects as the angiotensin converting enzyme inhibitors, but less cough and angioedema, and they should not be combined with the angiotensin converting enzyme inhibitors because they have the same mechanism of action and adverse effects. So blockers, angiotensin receptor blockers are also teratogenic, and that is why absolutely contraindicated in pregnant women. The renin inhibitor is only one aliskiren, one drug, but the has the same mechanism, but inhibits the renin that prevents formation of angiotensin Y from the angiotensin gene that is actually found in the blood. So the calcium channel blockers are a recommended treatment for patients with diabetes or angina, and high doses of calcium channel blockers should be avoided because of increased risk of myocardial infarction and uh, because of the vasodilation and reflective tachycardia. So the main classes include the diphenylalkylamines, that is verapamil, benzodiazepine, that is diltiazem, and dihydropyridines, that is the nifedipine. So the most of these drugs have short duration of action. That is why sustained release preparations are available for one-day dosing. So amlodipine has the highest uh, duration of action and does not require the sustained release formulations. Adverse effects include the uh, constipation and also the atrioventricular block, that is type of the arrhythmia, and all these drugs should be avoided in patients with heart failure because of this side effects. And also dizziness, headache, and fatigue may be felt by the patients because of the decrease in the blood pressure, that is very high decrease. So edema is also seen, and nifedipine can also cause a gingival hyperplasia. So the centrally acting drugs include clonidine. Clonidine is a central acting alpha-2 agonist that produces inhibition of sympathetic cardiovascular centers in the brain and then decreases sympathetic output to the heart and vessels. That leads to the reduction in the peripheral resistance and decreases blood pressure. So clonidine is usually used when other drugs are not effective and is taken orally and can be used as a transdermal patch. Adverse effects include dry mouth, constipation, and sedation because of the central effect. Uh, so discontinuation should be slow, like beta blocks. And also the methyl dopa is also alpha-2 agonist that is converted to the methyl norepinephrine and in the central nervous system it decreases the adrenergic output from the central nervous system. Common side effects drowsiness and sedation, and also in pregnant women it can lead to the uh, suicidal thoughts. So that is why it's used in pregnant women because of the low no side effects and the only safe antihypertensive medicine uh, for the pregnant woman. But after the delivery, there may be a suicidal thoughts because of the depression. So that should be monitored carefully. So I think that is all for today, and thank you for attending uh, the lecture, and see you next week.
See you.